It is great to welcome today Dr. Bandy X to the program, who is a Yale University forensic psychiatrist. And this is maybe a field, Dr. Lee, that not everybody is familiar with. Can you talk a little bit about forensic psychiatry and the work that you do?
Yes, a forensic psychiatrist works at the interface of psychiatry and the law. And so, in terms of my clinical work, I mainly work in prisons or state hospitals where many legal issues may become important. And we do evaluations for courts. Such as capacity to stand trial or criminal responsibility. I do civil cases such as asylum cases. And I also have been teaching at Yale Law School for 15 years. And so there's a lot of overlap between the law and psychiatry.
So one of the general skills and abilities seems to be evaluating sort of the state, the emotional state, the cognitive state of individuals, often in the context of criminal proceedings, but also in other contexts as well.
Yes.
So you have grown quite a following on Twitter and elsewhere because of some of the observations you've made about the president, Donald Trump, and to make it totally transparent to the audience, you're very concerned about the behavior and the actions of the president. When did this first become something you started paying attention to and started to speak out about it? What was it that you were seeing from the president?
You know, I was very distant from any of the political world and was mainly working as a clinician and academic. And although I have consulted with a number of governments on public policy and prison reform in particular, I had not considered politics to be a domain for me to speak about. But the day after Donald Trump's presidential election, I was contacted by numerous members from the public, from civil society members and others who had known of my work. And so I was inundated with phone calls and messages. And I had to think to myself, if I have been working as a violence expert, which is my area within forensic psychiatry and also in public health, I had been working to prevent violence at multiple levels, individual, collective, societal. And would I turn away from the situation when it poses perhaps the greatest level of danger that we could ever face and potentially be a trigger for the greatest amount of violence in society?
What were the first behaviors of Donald Trump's that made you realize that there's that possibility of danger and violence?
Well, there are many trigger signs that we look for in terms of danger and violence proneness, and because past violence is often an indicator for potential future violence, we look at things like verbal aggression, history of boasting about sexual assaults, and inciting violence, as he has done at his rallies. And definitely during the presidency, he has taunted allies and enemy nations with nuclear power. And all these are signs of danger. Of course, there are also psychological characteristics that he exhibited, including impulsivity, recklessness, a need to constantly burnish a sense of power, preoccupation with a grandiose sense of self-image. All of these things are associated with violence and therefore things to look out for.
So inevitably, and even in the responses that you sometimes get on Twitter, people will bring up the Goldwater Rule. The Goldwater Rule, you're not supposed to diagnose, you're not supposed to assign conditions to people who you have not examined in person. And increasingly, I'm reading more and more about how that was really a sort of political convention more than any kind of sort of definitive clinical consideration, and that it dates back to Barry Goldwater and the idea that there was an effort made to prevent so-called armchair diagnosis of what were concerns about Goldwater. Before we go further, maybe you should address that in terms of what is okay for you to observe and comment on, having not examined Donald Trump in person.
Well, first of all, the Goldwater Rule is unusual in that it was, as you say, a political compromise. It did not derive out of research or clinical concerns or professional practice, but rather out of a lawsuit against a popular newspaper at the time called Fact Magazine, which had done a survey of psychiatrists. And it was unusual for the American Psychiatric Association to come up with an so-called ethical guideline in response to a political situation. But under the Trump presidency, it has certainly been abused. It has also been modified about a couple months after Donald Trump's inauguration. They modified it to cover not just diagnosis, but any comment on a public figure of any kind. That actually goes against the original Goldwater Rule, because the original Goldwater Rule was an affirmative obligation in that we should participate in activities that promote public health. And so when we're asked about a public figure, we should educate the public to improve its health and well-being. Just not diagnose, because the diagnosis you cannot do unless you have all the medical records. And nowadays we do diagnosis not by personal interview alone, but by external observation and getting collateral information from those who have directly interacted with the person. So one might say that the rule has also been invalid since 1980. Definitively, it was considered outdated since its inception in 1973. But since 1980, our diagnostic practices have changed in that we don't just rely on a personal interview.
So that having been clarified, I'd love to get your perspective on where or if sort of some different areas of concern with the president overlap or where they are separate. So you've already talked about the sort of personality traits, past glorification of alleged sexual assault, et cetera. You've kind of outlined that. We then have his assertions about the cognitive test he has taken and claims to have passed, that we believe is the Montreal Cognitive Assessment, which includes identifying a few animals, counting backwards from 100 by 7, drawing a clock, remembering words, etc. There's that piece, and I'm curious if and how that interacts with your observations so far. And then there's also the mispronunciation of words. Yesterday, in fact, repeatedly referring to fatalities as fatilities, and having an expression on his face that he seems to know he's saying something wrong but unable to correct it. The oranges of an investigation is another example where there was an expression of recognition that something was wrong but unable to say, oh no, I mean the origins of an investigation. Are these three categories related? Are they separate? How do they relate if so?
So, I had been listening to Donald Trump's interviews about this so-called recent cognitive test that he's taken. And it turns out it is the test that he took over 2.5 years ago under White House Dr. Ronnie Jackson.
Yes. And
you're correct in that it turns out to be the Montreal Cognitive Assessment, which really is it's first of all not a fitness exam, as Dr. Jackson tried to assert it was. And also it is not even a good cognitive screen, because research studies have shown that full-blown Alzheimer patients and hospitalized schizophrenia patients can equally ace the test. And so therefore the Alzheimer Research Consortium came out stating that the screen should not replace a full neuropsychiatric or neuropsychological examination when it's indicated. Well, for the president, it certainly is indicated, because he has shown not only numerous multiple very grave signs of cognitive impairment as well as decline over time. We have considerable information on him because of multiple public appearances over time, and it shows a pattern of decline that is recognizable for clinicians. In other words, often people become concerned about Joe Biden, for example, but in comparison, Mr. Biden's impairments are superficial and more recognizable as non-concerning ones, whereas Mr. Trump's impairments are fit the pattern of very serious ongoing cognitive decline that is related to his own family history of dementia, which he would be predisposed to because of his family history. And now I'm not really making a diagnosis here because I'd like to point out that this can indicate multiple possibilities of cognitive decline. For one, does not simply come about because of dementia or other neurodegenerative diseases. It can occur because of stress, because of worsening psychiatric conditions that he may otherwise have, or it can be a whole host of other things. So that's why we don't diagnose without having all the medical records and without doing a fitting examination. Even if it doesn't include a personal interview, we need to do an examination of the data that are appropriate. And so what it does indicate, however, is that we are seeing signs of very serious pathological processes that need a thorough examination, not a 10-minute screen like the Montreal Cognitive Assessment. And I believe that the president has been bringing this up himself because he himself is concerned about his own mental fitness. He often brings up topics when he feels that he needs to fight his own notions, and of course others as well, that he may not be fit for duty. And he has very valid reasons for concern, but he does this by trying to convince himself that he is fit, and in addition to trying to convince others. And so he is repeatedly bringing up this test that he had done 2.5 years ago, I think relates to Dr. Ronnie Jackson, who was a White House employed and as a military officer subordinate to the commander-in-chief. And so he would not be in a position to do a fitness test. He does not have the independence, but he still used this 10-minute screen to declare the president mentally fit in a press conference. And so that in itself is a considerable breach of medical ethics. I don't know whether or not he was aware of his false declarations, but because of this episode of his perhaps administering a test that really would not tell us very much, but doing so anyhow, was perhaps an attempt to reassure the president. But above all, it ended up misleading the public when the public was raising many questions about the president's fitness. Now, Dr. Jackson has been removed from his position about 2 years ago, and amid other allegations that would make his medical ethics and standards of practice questionable.
We're going to go to a break on the podcast, TV, and radio show, but we'll have our complete conversation with Dr. Lee on our YouTube channel. So from a public-facing perspective that any of our viewers and listeners would be able to just go and look for themselves, what to you is the most significant publicly available video or audio of the president that would raise the flag the highest, in the sense that we've got getting off of Air Force One and wandering away, unable to find his vehicle and having to be brought back. We have the word problems, the speech problems that we've talked about. If you compare an interview from 10 years ago to one this year, the sort of facility with diverse vocabulary seems to have been significantly diminished, where there's a lot of repetition of a smaller number of words. But what is it that anybody would be able to just say, okay, this is what Dr. Lee is primarily concerned about in terms of the evidence?
I'd first of all like to emphasize that it would be difficult to make an assessment based on just one video or one speech. And so I am referring to a pattern over time, over decades, in fact, of numerous interviews and numerous patterns of speech that have changed. And you're absolutely right in that his wandering off from losing his way is a red flag, a very concerning sign in relation to his dramatically shrinking vocabulary, and just about any speech that you can hear nowadays notes his veering off topic, his inability to stay on topic, his repetition of stories, his increasing repetition over time, and also something that we call loose associations, in that he jumps from one topic to another that are not essentially related to one another, but in his mind, in his own logic, they are related. And so all of those things are concerning and are happening in the presence of other symptoms, such as his increasing tendency to espouse conspiracy theories, to detach himself from reality, to show greater signs of impatience, impulsivity, poor decision making, and inability to take in information that is important, inability to consider consequences before making very momentous decisions, and all of the things that we actually formally assessed in a mental capacity evaluation. I can tell you a bit more about that if you'd like.
Yeah, well, so, I mean, I think maybe this is a good time to compare and contrast. You mentioned Joe Biden, and some people immediately around Donald Trump, including his son, have been, over the last 3 to 4 weeks, kind of pushing this idea of Joe Biden has dementia. And you've already alluded to this a little bit in saying that what you see with Joe Biden is different. To me, as a layperson, if I see Joe Biden's debate with Paul Ryan in 2012 and compare it to the way that he's conducting interviews now, there is a difference. I can't say there is not a difference. And it seems like sort of a slowdown is the very informal way that I would describe it, as a guy who's now 78 years old rather than 70 when he was debating Paul Ryan. But from your perspective, which is a trained eye, can you talk a little bit about what's different about those details and what you see with Joe Biden versus Donald Trump?
Well, first of all, I would refrain from making any specific comments because I have not observed Mr. Biden enough. Also, I don't generally comment on public figures unless they pose a danger to society and a danger to the public's well-being, which is my threshold for commenting on public figures. And so what I will say is that there have been not really glaring signs that would make me concerned about any catastrophic danger to the public. I do notice the things that other people have remarked about the changes over time, and also the different gaffes that many people have remarked on, which for the most part I will in general just say that they are that they would fall under a more superficial category than the ones that we see with Donald Trump, which are truly serious impairments that would concern us about catastrophic danger to the nation's well-being, if not the world's.
How can we tell the difference? And maybe, I mean, I'm curious what would make it rise or not rise to that threshold of danger that you talk about.
So I told you about the violence proneness and the apparent mental incapacity that Mr. Trump has exhibited. Mainly, what we'd be concerned about in terms of public safety are dangerousness and unfitness. And with regard to dangerousness, it would be the president's apparent violence proneness that he has already shown and that he has actually demonstrated throughout this presidency and actually placed our nation in danger multiple times. I mean, there could be a whole list. He has brought us to the brink of war numerous times. He has taunted other powers. He has severed or weakened our relationships with allies. He has destabilized our position geopolitically. These are the kinds of things that would be particularly dangerous. And in terms of unfitness, we actually did do a mental capacity evaluation on the president when the correct information became available. Now, this is the special counsel Robert Mueller's report, which contained multiple reports from close associates and coworkers who had direct interactions with the president. And if the report was not enough to indict a president, it was certainly enough to assess mental capacity, that is, the capacity to fulfill the duties of his office. Now, without the basic the mental capacity, there's no chance that he could be mentally fit, that he could be fit for duty. And he, in fact, failed every criterion. The criterion include the ability to take in information and facts, advice from his advisors as necessary to the situation, the ability to be flexible and manipulate the information he receives, not be bound to fixed ideas or conspiracy theories, to be able to make decisions that are sound, reality-based, and rational, that consider consequences and are not done impulsively, and that he goes back and forth after making this decision. These are all factors we consider in a mental capacity evaluation. So that he failed definitively. And for that, we do not need a personal interview, although we did invite him for an interview in case he considered himself fit and would like to give us information that might overturn our findings. But this was definitive, and it was done by independent top mental health experts, a panel of them, and it was done for in service of the public in order to inform the public of what it was facing. Now, these are the kinds of information we look for when we suspect a person would be dangerous in the president's position. And these are not the kinds of information we found in Mr. Biden, but we have certainly recommended that any candidate for the presidency or vice presidency submit themselves to an independent expert panel who can do a fitness for duty exam. It is fairly rapid. It's not a diagnostic exam. It doesn't involve a review of one's entire medical history or medical records. It simply assesses whether or not the person is ready for duty. And so we definitely do recommend this of Mr. Biden himself.
So that was going to be the last thing I was going to ask, and you sort of addressed it, which is certainly if we were to require or recommend or request that anybody who might be president be screened, it seems very clear that the Montreal Cognitive Assessment falls dramatically short of counting as anything definitive, as you've pointed out. And would the furthest that you could go be a full neuropsychiatric evaluation with a full review of medical files? Like, would that be the complete opposite end, and you're recommending something that is not quite so involved?
Yes. It would allow for a diagnosis, which would also be able to give a prognosis in terms of his trajectory over time, and also enable us to treat him for any conditions that would be of imminent danger to his own personal health, which would then, by extension, affect his fitness for duty. So, yes, that is something that we would recommend. But above all, he needs an examination by an independent panel, not tied by his by under employment by the White House, or not politically um, involved in terms of their potential promotion and so on. And this is also where the American Psychiatric Association needs to rescind its political compromise, which has gone only in one direction, only in the direction of not commenting on a public figure, regardless of need, when there are specifically areas where we ought to comment in order to improve the public health and to do our professional responsibility to society, which is absolutely one of our duties as psychiatrists and mental health professionals, in addition to seeing patients and treating individuals.
We've been speaking with Dr. Bandy X. Lee, who is a Yale University forensic psychiatrist. I so appreciate your time, and thank you so much for sharing your thoughts with our audience.
Thank you so much for having me.